Oh, they're going to give me a timer. About 10 years ago, Andy asked me a question. Will your coalition ever be involved in community work? And I gave an emphatic no. Coalition's been around about 30 years, 32 years now, and our average size employer is 600, but we represent 25% of our community. And that is important. There was a time when employers hired young men and young women out of school. They'd work for 10, 15, 20 years before they developed a chronic illness. Today, our employers are hiring young men and young women out of school with advanced chronic conditions, 2 and 3 sometimes. I'll show you some of this data. So why engage the employer? Well, we've been talking about large employers versus smaller employers. Now, our employers don't consider themselves small. In our community, a 300-man group is very large. And these CEOs are embedded in the community because these are closely held, privately owned employers for the most part. We actually think that the nationally owned companies and businesses in our community are actually a hindrance to the work we actually do because they don't work with us. They have their strategic national plan, and they don't work with the local community. The other thing about small businesses in a community is they're owned by people who have long, deep roots in the community. And the CEOs and the C-suite are all local people. Whereas on the national employers, they come and go. Every year, every 2 years, they're moving in and out. So we can't get their attention. So when you talk about engaging employers, you need to understand who it is you're actually engaging. Because for the small employer who's locally owned, who's in the community, it is their community, it is their family, it's their friends. And the employers have been doing worksite wellness, prevention, and disease management for a very long time. They do population health, but they don't understand population health. They've never been trained in it. They don't understand the language of population health. But they do know what they're doing for their own employers. And I have an employer in my coalition who only has 50 employees, but it is one of the most outspoken CEOs I have in the coalition. And he is not afraid to go to the local leaders and the local organizations and get things done. So it isn't necessarily the size of the employer, it's how willing and vocal they are and how anxious they are to get involved. Interesting. I have a whole chart that's gone. The data I was going to present here in this particular chart was health risk assessment data from 3 employers in Savannah. Represents about 10% of the population. They have a diabetes rate as high as 34%. This is health risk assessment data done by bioscreenings. This is not self-reported, but it was verified by clinical testing, 34%. CDC and the other data that we get says that our incident rate is lower. Well, the problem with this is data. The data that we're looking at is not local data. So we've begun using local data based on health risk assessments. Now this one shows up. This is the county. This is one of the large employers in town. And you can see that their pre-diabetic rate is almost 80%. This is diabetes or pre-diabetic 80% with an obesity rate of 50%. So why should we engage the employers? Because we have people living in unhealthy communities. This is where our workforce comes from. When employers begin looking for a site to build a plant or to move their headquarters, they are beginning to look at what is the health of that community. It isn't just anymore about infrastructure and education and workforce availability. We're also now having to say, how healthy is the workforce? So a few years back, in 2011, we received a grant through NBCH from the United Health Foundation where we pulled together some of the key community organizations and said, what do we need to work on? And we set we said, what are the priorities in our community? And these were the ones. And specifically, the group wanted to work on childhood obesity. And we were surprised at that, but that's what we got. So we started doing it, and we planned, and we brought together everything that we could find about childhood obesity. And we found that 1 in 3 children in our county were overweight. But then we went to another source of data and said 1 in 3 are obese. Which is it? Are they overweight or are they obese? We found the data was based on 5 counties in Georgia that then was overlaid on our demographic information. Well, our county and our community is not the same as Fulton County up in Atlanta. It's different. So one of the things that you saw on our priority list was local data collection. And there is a local data collection collaborative now that has begun, and we have begun pulling together local sources of data that we can have our own data. But the point is our children are fat and they are overweight. We received an implementation grant based on that work from United Health Foundation and Robert Wood Foundation to continue our work. And one of the things that we've been able to do is this. In Georgia now, there's a law that all children in public schools, K through 12, have to do a fitness exam and do a body weight, BMI, height weight. The 2 bars that you see, the green and the red, that's our best performing elementary school and our worst performing elementary school. And you can see the difference. And we talk about disparity. We have children in one of our elementary schools where nearly 80%, and close to 78%, I think, are overweight. Even our best school, at 25% of our school children being overweight is too much. But when their parents, when the workforce of the parents of these children, 50% is obese, it's not too far a reach to see why these children are also overweight and obese. Now, the 2 charts on the side are the newest data that we've gotten from this year, where it shows that about 40% of our children are not healthy weight, not what they call the healthy zone. We're using FitnessGram in Georgia. But one of the things that absolutely shocked me was 7th graders, that 33% of the 7th graders failed all 5 of the fitness tests. So when we see the Department of Defense, which has a very big presence in Savannah with Marines just north of us and the Army right there, they can't get enough enlistments of young men and young women who can pass the fitness tests. This is why. So we have these different groups in our community that we're working with. Did we think 10 years ago that we'd be doing this? Absolutely not. We were working with our own employees. But we've been doing a lot over time, and it's amazing what we have done. But the ones that are national, we use those as information sources. Now, the employers don't know any of this. My members couldn't tell you what Leapfrog is. They couldn't tell you what Bridges to Excellence is. They couldn't tell you what the Health Transformation Center was. They don't know this stuff. That's why they created the Business Coalition. I become an extension of their staff. And they tell me, keep doing it, as long as it's making improvements and it's helping us get our people healthier, as long as it's saving us money, keep doing it. So we keep doing it. And on the local level, we have found ourselves on several of the boards. Who would ever thought an employer coalition would be a board member of a safety net council? But when we sat down and talked with our safety net providers, they were complaining about prescription refill rates, and they were complaining about no-show rates. And I sat in the meeting and I said, that's no different than what we have. And all of a sudden, there was a light bulb moment when everybody realized we all had the same issues with our covered lives and the people that we were responsible for. So as we move forward, we will continue to work. One of our big tasks now, and I've talked to our federally qualified clinics, we have 2 in town, is I want to take their data of the uninsured and compare it to the insured. Let's take same diagnoses, diabetes or whatever it is, and let's look at it and see if we have disparities, and let's begin working on quality measures that have been laid out. They're very clear. And let's have one message with one measure and one standard that's used for every single person within our community. Thank you.